Hi, my name is Radine, and I'm here to discuss the PICO framework. As medical professionals, you will be expected to know everything. While that is impossible, here's a framework to help you find the answers you need. To make sure that care is grounded in the best available evidence, health professionals often turn to tools like the PICO framework. What is PICO? It's a tool for forming a clear research question by breaking down complex topics into four simple parts. PICO is an acronym. It stands for the following: patient, population, or problem, intervention or treatment, comparison, and outcome. As you can see, the PICO framework is ideal for anyone in health services using evidence based practice. Consider the following scenario: you're a nurse practitioner in an orthopedic ward. Post op knee replacement patients often report high pain levels, even with opioids. You're exploring whether continuous femoral nerve blocks, or CFNB, might reduce pain and help patients walk sooner. In this case, the P, which stands for patient population or problem, are patients who just had knee replacement surgery. The intervention or treatment would be the CFNB. C, or comparison, refers to the usual method used in previous cases. Sometimes it may not even exist. In this case, it is the opioid only pain management. O is for outcome, which is where we ask ourselves, what do I want to happen for my patients? In this case, you want to see if CFNB will lower pain and help patients walk sooner after surgery. Now that you have determined the four main parts of the situation, you can now develop a focus question to start your research. When you put it all together, you get the following. In post op knee replacement patients, does using continuous femoral nerve blocks compared to opioids alone lead to better pain control and faster walking? These are the questions to ask when you are using the framework. What do they have in common? What new method or solution am I considering for this problem? What's the usual way this problem is handled right now? What do or don't I want to happen for my patients? Now you try. George wants to discuss the possibility of a vasectomy. He says he has heard something about vasectomies causing an increase in testicular cancer later in life. You know that the risk of this is low, but you want to give him a more precise answer. So, what do they have in common as far as the population? They are all adult males that are affected. What new methods or solution am I considering for this problem? The intervention, in this case, would be the vasectomy. What's the usual way this problem is handled right now? As we mentioned before, sometimes there isn't a comparison, so we'd put none. What do or don't I want to happen for my patients? And the outcome for us is considering testicular cancer as a possibility. So, our focus question would be: in men, does having a vasectomy increase the risk of getting testicular cancer in the future? So, whenever you're trying to solve a health problem or do research, use PICO to break it down and you'll have a clear focus question to guide you. My name is Radine, and thank you for your time.